Okay, so whenever you're looking in the cavity here, you'll see the really large hepatic portal vein, which is injected with yellow here. The arteries are injected with pink. This is the hepatic portal vein. This is the hepatic artery. And this is the bile duct. It's injected with pink as well. So they all run together. The vein drains blood, and all the blood would run up here into eventually the sinus venosus, whereas the arteries are supplying blood to different things. So this artery is actually running cranial to the liver to supply blood to it. And if you are worried about confusing the bile duct, if you follow it up, you'll just be able to see that it goes into the gallbladder here and here. And then also, whenever you go further down into the hepatic portal vein, it branches. One of its branches is the gastric vein, and it's right here, going to the stomach. And then you have the lineomesenteric vein that goes to the dorsal lobe of the pancreas. So this is the dorsal lobe of the pancreas. And then this right here is the lineomesenteric vein, and it goes up to the spleen. That's why it's called lineomesenteric. And then the pancreaticomesenteric vein is really short, and it goes right here to the ventral lobe of the pancreas. And it ultimately becomes the anterior intestinal vein. And here you can see the anterior intestinal vein and arteries run together. So on the exam, I'd have you specify the artery versus the vein, just because they do run together, whereas the other ones, some of them don't run together. So I'll try to specify what I'm asking for on those. And then whenever you look up here, you have the dorsal aorta. Coming off of it here is the subclavian. The subclavian then goes into the brachial, which would go, if the fin was still here, the pectoral fin, that's where it would go. On mine, I cut off this entire wall, so you can't see the anterior ventrolateral artery, but if it was here, you would see the artery running down, and it would go all the way down the side to the posterior ventrolateral artery, which you could see here, which comes off of the iliac artery. The iliac artery branches into the femoral, so if the fin, the pelvic fin was here, it would go, the femoral would run into it. So those are the two branches of that one. And then whenever you look back next to the hepatic portal vein, you have the celiac artery right here. It's separate, it doesn't have anything else running into it. And then from there you have the pancreaticomesenteric artery, and that one runs next to the pancreaticomesenteric vein. So you could see them running together. So this again was the pancreaticomesenteric vein. The pink one was the artery running off there. And then from there, you also had it goes into, again, the anterior intestinal artery and vein. And then you have the gastrohepatic artery. So from the celiac, it branches into the gastrohepatic. One of the it's called gastrohepatic because it itself branches again, so you'll need to know those branches. The gastric artery would be going to the stomach, and then the hepatic would be the one you saw before going to the liver there. And then you also have the lineogastric artery, which you can see here. So it's lineo, goes to the spleen, which is here. And then you have the anterior mesenteric artery, which is here. And again, they can come off the dorsal aorta. The anterior mesenteric artery runs into the posterior intestinal arteries and veins. So you could see them here. These are the posterior intestinal artery and vein. These are anterior intestinal artery and vein. And then the posterior mesenteric artery goes to the digitiform. So it's the artery here, and its vein, it doesn't have a vein that runs along with it. And that's pretty much it.